you were speaking to a healthy 22-year-old woman today, what would you encourage her to start doing to protect her fertility in the next 10 years?
If you have a steady relationship, permanent it. Because when they get to 35 years, their ovarian reserve will drop drastically. They may not be able to conceive using their own egg naturally.
Why is it that you mentioned that a 57-year-old woman could have a child? I want us to emphasize on male fertility.
To assess a man is the simplest thing you can do. To assess women, you have a lot of invasive things you will do, but they cannot come to give you that sperm.
So you can say men are one of the issues.
No, they're not. No, not. It's a couple thing. It's a couple thing. As we are inside this place, okay, we're able to sit because we have this seat. Let us assume that I enter there, there's no seat. Can I sit? No. So if a baby comes in, there's no place to implant, the baby just dies.
So are you saying that even a man with low sperm count can still have a child?
Why not? If you have one sperm cell, it's not only one sperm cell that is needed to fertilize the woman.
But most people say, oh, if he has low sperm count.
The law does not permit a woman, a doctor, or anybody to participate in termination of pregnancy.
Welcome to the very first episode of Her.Body.Talk Podcast, where we share, educative videos, educative topics related to women's health and condition. We educate, we enlighten, we empower and inspire women about their health. And today we're going to be talking about a topic that many individuals and families have so many misconceptions about, and it is fertility. Joining us today is Dr. Okpara, a fertility specialist. He owns a hospital and he's been in practice for a very long time. So thank you very much for joining us, Mr. Okpara. Can you please introduce yourself to the audience?
Okay, thank you. My name is Dr. Okpara. I'm a consultant gynecologist, fertility expert. I have a small clinic in Oka here, Hilton Consultants. Thank you for inviting me. Surprising, I'm hearing that is your median episode. So I'm a bit maybe blessed to be the first person that will grade this. So thank you.
Thank you very much for joining us. So my very first question is, what is one moment in your career that you will never forget?
Okay, as I said, I'm a fertility expert, and for the past 15, 16 years, I've been managing women and more on fertility issues. I've had a lot of cases that are interesting to me, but there's one particular one because, when it comes to fertility, age is a factor.
Yes.
I have this woman that is 57 years old, and at 57 she's already postmenopausal, so hope dashed. And because coupled with that, she had 2 fibro surgeries, so meaning that the uterus have been tampered. So people would gone to many hospitals, traditional home, they told her she can't conceive again. People even told her that she has used her womb for something else. So she got devastated. Then came to the clinic. We evaluated her, found out that the uterus is still intact. So we conducted IVF for her. She conceived.
Wow.
And finally delivered twins.
At 56.
A boy and 57 years.
57 years.
A boy and a girl. If you can see the face of the woman that they joy in her and the family, to tell what science can do. So that particular episode, the particular case was.
So it means that you guys are specialized in giving people babies.
No, it's God that does that, but with science we can assist.
That's very good.
Okay.
So, after caring for so many women and couples over the years, has there been any patient whose journey changed the way you perceive fertility and work as a fertility specialist?
Okay, it's not a particular woman, but having been seeing women, I found out that infertility is not just a diagnosis.
Oh.
I think it has to do with a lot because it encompasses the emotional trauma these people pass through, the financial aspect of it. So I can't just pinpoint one particular case, but it's beyond what we see in the ordinary. And I think people should be empathic to anybody that is passing through infertility.
Wow.
So not particular case, but I think it's more beyond what we see on the surface.
So is there a conversation about fertility that couples, often avoid to really speak about?
Yeah, there's one thing you have to understand in this fertility issue is that, especially in this part of the world, people find it difficult to discuss their problem.
Yes, that's
and they more especially the males, they find it difficult to talk about their inability to conceive. So you see them shy away rather than telling people what they have or the issue, because it's only when you talk that you can access care.
Yes.
So you see them shy away. They don't go to the hospital, they do self-medications, and also they lose self-esteem. Now, when someone loses his or her own self-esteem, he has lost everything. So people shy away discussing this particular issue. And I remember that fertility has to do with sexual intercourse.
Yeah.
Now, they also find it difficult to come to hospital to discuss their sexual life. And it's only when they discuss their sexual habits that you can assist them to know whether they're even having enough exposure and other things.
So do you think it's a psychological issue for the male aspect?
Yeah, it should be. But one thing about males is that we have ego. I kept telling people, even when I teach medical school, I said that the challenge with males is that they have this ego in them. And they feel that telling people about their sexual life will affect that ego. And it makes them to shy away from it. Even if in the clinic, if you come to the clinic, you find out that the women will first access the clinic. When they get to the clinic with the husband find it difficult to get into the clinic. Sometimes you see them, they will be outside and say, okay, whenever the doctor wants me, will come in. Then when they get to the clinic, inside the clinic, you see them pressing their phones, see them
like they're less concerned.
doing as if they are not interested. But down inside them, they want that child more than the woman.
So are you trying to say that if you find a couple now that is trying to conceive or looking for a baby, are you advising them to see a psychologist first before coming to the doctor?
I don't think so. But a psychologist should work with a gynecologist, fertility expert. Like in our clinic, we'll have a clinical psychologist because we do IVF. They should work hand in hand. First, you need to make a diagnosis. Excuse me. You have to make a diagnosis first. Then the psychological aspect will now be management of the patient. Psychology will follow. You don't start with that. Except in a situation where you have, because I have different types of patient. There's a situation where you have a patient that has a psychological issue. You find it difficult to discuss his case, or he has, let me quote, a psychiatric challenge. You may need a psychotherapy first before you now talk about. But basically, they first get to the hospital, being assessed, then the treatment, as you're doing the treatment, then the psychologist will come in.
All right.
It shouldn't be the other way around.
Very much. If you were speaking to a healthy 22-year-old woman today, what would you encourage her to start doing to protect her fertility in the next 10 years?
Okay. Unfortunately for ladies, they have what we call time clock. That is, their own fertility is limited within a short while, from menarche, that's the first menses, to before menopause. So we have a fertile period for that for them, not more than 10 years sometimes. So if you see a 22-year-old lady, that means that is her peak of fertile age. And she may not know. So you have to let her understand that at this age, this is the age you should be careful with your life. If you have, for me, I normally say, if you have a steady relationship, permanent it, so you can start to have your children. Then if you don't have, you should be careful with your life. Because have female reproductive tract that if you have sexually transmitted disease that is not well treated, it may affect the ovaries. And not the ovaries, the fallopian tubes. And if fallopian tubes are affected, it will get blocked. And it's only in the fallopian tube that you have fertilization. So if a woman is not careful, she may contact sexually transmitted disease. And what will happen? The tube will block. Secondly, some of them will say, okay, I want to pursue my career, forgetting that fertility will not wait. Okay? Yeah. So you say if you have a stable relationship, try maximize it. Because when they get to 35 years, their ovarian reserve will drop drastically. They may not be able to conceive using their own egg naturally. So my advice to that person is to be careful, live a healthy lifestyle, then try as much as possible to start to produce children as soon as you can.
So talking about age now, you said something about age, right? But biologically, like you said, if you're from 35, your ovarian this thing will start, dropping. Why is it that you mentioned that a 57-year-old woman could have a child?
Okay. Science can do a lot of things. And now, if you know the physiology of conception, it starts from ovulation. The sperm moves from the vagina after sexual intercourse into the uterus. then to the fallopian tube.
Yes.
Then baby will be formed in the fallopian tube. When the baby is formed, it gets back to the uterus to implant. You can do this fertilization outside the body. So if a woman cannot ovulate, IVF can be done for such a woman. So what you may need to do, a woman may need to borrow an egg from another person, then use it to fertilize the husband's sperm if it is okay. If that sperm is not okay, use the borrowed sperm to fertilize, then put into the woman's womb to carry. I'm not going to tell you whether the woman did that because that is secret for the lady, okay?
Yeah.
So, but at advanced age, from 40 years and above, it may be difficult for a woman to conceive naturally.
Wow. Wow. So why does the society, whenever we talk about infertility, children issue, children are not coming, why does the society secretly or stylishly look at the woman first?
It's not supposed to be. But, in Africa, it's the woman that carries the baby. So we born
But
into
if you don't give us, we
yeah,
will not carry.
I understand. But we came into this world believing that the women are the one that's supposed to, they carry this baby, so they're responsible for pregnancy. So if a woman is pregnant, she's the one that you see. I'm not saying that it's supposed to be so, but that's how society sees. But unfortunately, it's not supposed to. And that's what we'll tell them in the clinic, and it's changing nowadays. Before now, if there is infertility, the man takes another wife. Sometimes he will marry a pregnant woman.
Some people still do it.
Yes, I know, but it's not as common as it used to be in the past. Education has done a lot for us. So in the past, people used to think that it's the woman that is the cause. But we have 50-50. You have about 40% of infertility caused by the man alone, the other 40% by the woman, then the remaining 20% by both couples. But the society may see it as if it is only the woman, okay? And that's the reason why infertility is not an individual problem. It's a couple issue. So when they come to the clinic, what we normally do is that when they come to the clinic, you talk to the woman first because she's the one that will be moving around where health care so she can conceive. Okay, talk to her. Then say, bring your husband. We'll talk to him. Now you can't change your society overnight. I tell people you cannot just say, okay, because you've gone to school. Just like in Africa, a little bit digress. In Africa, if you have girls, everybody in the society will say you should try and see if you can have boys. You can't change it overnight. All you need to do is just educate everybody so that people understand that every child is okay. All right. So you need to educate the people in the society that the males are also part of the cause of infertility.
So everybody hearing now. Everybody hearing. So now, what are some everyday habits that people do not realize that quietly affect infertility?
Okay. One, I normally give, when I give lectures, I try to make it as natural as possible so that people will understand it. I say, when we live healthy life, we're likely going to stay longer. The reproductive organs, they are part of us. So they're not like a different organ itself. So if you're living an unhealthy lifestyle, it's going to affect every part of your body.
Yes. Without
excluding the reproductive organ. Let's take specifics. If someone is taking cigarettes, for instance, it's going to affect your body. Evidence has shown us it affects both the ovaries and the testes. So it's a lifestyle that is not good. If you consume alcohol in excess, it's also going to affect your body, including the reproductive organ. Okay. All right. Now, if someone is eating beyond what is supposed to, that becomes obese, it affects ovulation and also affects that of male. Yeah. So marijuana and so on and so forth. So any lifestyle that is not, that is not healthy to your own life will affect fertility. And that is the only way you can educate people. Because if you tell people, okay, for conception, you should live this, live that, people should see their reproductive organ as part of them. Right? So, and it can get disease just based on your lifestyle.
Yes.
Like if here you have radiation, if you're working in an environment where you have a lot of radiation, can affect your body. You may have lung cancer, can also have problem with the testes and so good lifestyle is what you need.
So talking about lifestyle, talking about healthy living, we used to see some I will not call them mad, insane people, women on the streets that have children. They're not living a healthy lifestyle. So how come?
Okay. All right. It's good I asked this. Look, that one is taking alcohol. Let me use alcohol for instance. One is taking alcohol does not mean that it will affect the body. All right? Yeah, it may not affect your body negatively because it depends on your system. And we cannot just look at you and say, okay, this person's immune system or body defense system is good enough to tackle all the toxins in the system. Remember, when you take something through your mouth, it gets to the liver. Now, the liver will metabolize it, detoxify the toxins in it, then send to the kidney for excretion. Take, for instance, that your liver is not functioning perfectly well. All right? Now, if your liver is not, now remember our lifestyle nowadays that people eat processed food,
Yes.
putting the liver to serious challenge. Okay? So, if someone is already challenged, I now introduce unhealthy
Extra
lifestyle,
challenge.
it will extra challenge, as you said. It will affect the body. Now, the mad people you talk of, they may be lucky. Remember what sometimes they may eat fruits and that, and the body is okay. So they don't have any challenge with the system at that particular point in time. And not all the madmen you see in the street are pregnant. Some of them may even be maybe having surgery and they are not pregnant. Okay. Now, if someone is sick, like what I told someone the other day, if someone is sick, you don't tell the person to take alcohol or you don't allow the person to take alcohol, take cigarette, take marijuana, or any of these recreational drugs. But when someone is healthy, when you take them, it may not affect your body the way it will affect the other person.
Yes.
Okay? So that's the reason why we say, because you don't know your system, why not live a healthy lifestyle? Especially for those that have infertility. Because if you come to the clinic and you have infertility, the best thing you do is to live a healthy lifestyle. Because that means that a part of your body is diseased.
Wow. So you mean that anybody can, you mean these mad people, let me not call them mad, insane people, if they are eating well?
No. See, look, fertility is not, why we discuss eating is because you brought it up. Fertility is not hinged on our lifestyle alone. Okay. Remember, okay? No, it's not hinged there alone. Fertility is about, as I said earlier on, for a woman to conceive, there should be sexual intercourse. That's the key thing. And sperm must be released. And that sperm must be a good sperm, or good sperm cells must be inside the ejaculate. Now, that sperm cells will travel from the vagina into the uterus to the fallopian tube. Now, the woman must ovulate. Okay, now, if these things happen, the woman will conceive. Where healthy living comes in is, if you're not eating well, it may affect your system, and the ovary of the patient may be affected, and the woman may not throw up a good egg. Okay? I say, if you're not, it may happen. It does not mean that when you don't eat well, your ovary will not do well. Okay? So, and since you know that eating well will help your system, why not eat well? Will you take anything out of your system? No.
All right. Social media is full of infertility advice. They say we should drink this one, drink that one. Okra water will do this. Okra water will do that.
Will help sperm.
Yes. So what is your say on it?
Yeah, social media is good. Internet is perfect. Without internet, we may not be able to have some information we have today. We're able to reach me because we have internet.
Yes.
Okay? But it should have limitations. It shouldn't be our next or our alternative doctor. You know, what happens in internet is that it's garbage in, garbage out. The sites you can get good medical information are restricted. You pay to get them. If I type in, let me use Christianity for instance. If I type in that Jesus is devil, you know, most of the Christians here will say this man is, who is he? Where is he coming from? You know, okay? If I type it and post it my site, if you search Jesus plus devil, you will see that document.
Yes.
And you read it. Then if it says from Professor so and so, with so and so, you say it's coming from an authority. So that's the challenge with internet. So it's a place where people dump information. So, and they cannot sieve the information. And nowadays, those in IT, they can also make some information pop up faster than the others. I might be the bad information. Okay? So that's why we don't advise people to go to internet to get medical help, advice. Then, coming to fertility, like what you said, you know, people equate things to what they see. I'll give you 3 examples. If someone has malaria, or if someone has diabetes, people will tell you to take bitter leaf.
Yes.
That will dilute the sugar.
They even said they're now exporting
Good,
bitter leaf.
but that's wrong. Because diabetes is all about that. You have sugar inside your system. You need to put the sugar inside, not to dilute it. Okay? So it's not to dilute the sugar, but to put it inside the system for your body to use.
Okay.
Then if someone has anemia, that's low blood level, they say take tin tomato because it's reddish in color. Okay? But it's not so. Okay? So, and so on and so forth. Now, when it comes to, like you mentioned, okra, because sperm draws, and they think also in a slimy environment to be easier for sperm to move. But when you eat okra soup, it ends in your intestine. It doesn't go to the reproductive system. Let's even assume that it can help. But it cannot even get to that place you want it to be. All right? So it makes no sense for someone to say, okay, take okra, it will help you to. No, it doesn't make any sense. And that's why it's good to, that's why the internet is good, but it's like a two-edged sword.
Wow. So beyond medical advice, what's the emotional burden of infertility that people often do not see?
Even without being told, you should know. Have you seen someone that is looking for a child? If you've seen one, it wrecks everything they have in the family. People sell their cars, sell their houses, borrow from their enemies in order to have children. Today, sometimes people have that's what is running on cryptic pregnancy when they are aware that they are not pregnant, but just for them to be happy. So you have a lot of emotional burden. And that's why when we say, if you see an infertile couple, don't say go home. Start as soon as possible and do whatever you can do to see if they can conceive. Because if you don't do that, they will make mistake. Like if someone comes to your clinic and it's okay, hey, you go and try for 3 months, try before you come. The person may leave your clinic, enter into one prayer house. From there, they will say that he's Obanja or whatever, take him to. So there are a lot of emotional challenge associated with. And if you see someone if you see couples that are infertile, they don't save anything. In fact, when they come to the clinic, they say, I don't have any other business except to have these children. Okay? And that's why it should be imparted. Then you shouldn't, when someone is passing through that, you won't come and say, okay, maybe you have a young lady that you used to know her in her past life, maybe she had a lot of girlfriend and terminated many pregnancies. So because what you did in the past, that's what you could. No, that's not so. Okay? It can happen to someone that is a virgin. Okay? So it comes with a lot of emotional challenge and you can't quantify, it's unquantifiable. All right.
So diving from fertility to IVF, since we've talked about fertility, what is actually IVF? What is IVF itself?
I call it science wonder. That's what I call it. It's the wonder of science. But IVF just simply means in vitro fertilization. In vitro means outside the body. In vivo is inside the body. So fertilizing outside the body. So what it means is to get the gametes, that the sperm and the egg, fertilize them outside the body in a specialized lab. So after fertilization, you incubate for 5 days. Because in natural life, what normally happens that there's fertilization in the fallopian tubes. Then it takes about 5 days for that fertilized ovum to get to the womb to implant. So you keep it in that culture medium for about 5 days, then take to the womb, transfer to the womb, expecting the woman to accept the embryo, die for it to implant. So that is IVF. It's a complex process in the lab, but it does wonders. Like I said before, someone that has lost hope can conceive through IVF. Okay? And a lot of things you can do in IVF, not only conception, you can also do gender selection there, you can also do sorting of the embryos. Like if someone has, like if you're AS and the husband is AS, they are not matching, and maybe love has made them to say this, if it's not this lady, it can't be another person. Okay, no, you won't advise them. But with the advent of technology and IVF, both of them can go for IVF. Then embryos will be formed. You sort them out, do what we call PGT, pre-genetic testing. So after that pre-genetic test, you can sort the ones that are not SS and transfer. So that love can still be there. Otherwise, you tell the man to go and marry
another person. But there's a possibility that if they transfer the eggs, is there a possibility for the genotype to change in the woman's womb?
No. I said, if you understand the genotype thing, if a lady is AS and the man is AS, they have 25% chance of having a sickler. They have 75% chance of not having a sickler. All right? They have 50% chance of having AS and 25% chance of having AA. That's each time they meet. So they can have a normal child. They can also have a sickle cell child. So what we're saying that why not collect these eggs, fertilize these eggs in the lab, then sort them out in the lab, transfer the ones that are good. This is what science can do.
So, but my question now is, even if you select the eggs and you select the AS and the AA, is there a possibility that when you transfer that eggs into her stomach, it can still change? The genotype can
Change to what? Can you change from your blood group has it changed? There are a lot of things. That's why the mites we should discard in this part of the world. And I believe you guys that do this podcast will try and disseminate this information. It's just like if a woman is pregnant, she's looking for a female child or a male child. And let's say someone touches her tummy, the baby will change. It cannot happen. Such cannot happen.
So what's your say on surrogacy?
Okay, it's part of IVF anyway. Surrogacy just means someone carrying a baby for another person. Okay? Now, if we are discussing IVF today, there are a lot of things I've told you guys, but be that as men, surrogacy is just you have a lady that she doesn't have a womb. Maybe when she was born, there was no womb. It can happen, but she has ovaries. Or maybe during her lifetime, her womb got destroyed, either by her own mistake or that she had something like fibroid, went for fibroid surgery and the womb was destroyed. Maybe she was having heavy bleeding and the doctors felt that it's better to remove the womb for her to be alive. Or maybe that woman is not fit to carry a baby. She's ill. Maybe she's taking chemotherapy and she's not mentally strong to carry a baby, but she still have wonderful ovaries. You can stimulate such a woman, get egg. After, you don't need her body to fertilize the eggs anymore. Get the egg, get the husband's fertilized, keep in the lab. Then find another lady who you contract to carry the baby. Or the baby can stay in any womb. Okay, so that is what surrogacy is. Now what now happens that baby is not, the surrogate mother is not the owner of the surrogate, the baby or the babies that come out of that procedure. The baby will now be handed over to the commissioning parents. That's what we call them. Commissioning parents are the people that have
child.
Yes, the child.
So if there's
and it's a good thing.
If there's one trend you want to, you want to dispose about fertility, what would it be?
In fact, it can be one thing. One is believing that the problem is from the female. That's number one. Second thing is a lot of things our people believe that have nothing to do with infertility. There are a lot. If I start to enumerate them, just like someone comes to the clinic, just mentioned, someone comes to the clinic and tells you that the problem is that the sperm is watery. Okay? Now thinking that is this what you see is what makes the sperm what it will be. But what makes sperm what it is the content of the sperm. Okay? Now believing that someone somewhere is responsible for our wife's inability to conceive. So there are a lot of things that you need to dispose with regards to infertility. Okay? So I can't pinpoint, there are a lot.
Especially Africans, I mean.
No, the challenge is because we have high premium for having children. That is also the problem. In other parts of the world, couples may decide not to have their own children, will come to Africa to adopt. Okay? Then couple can decide to defer having children. Later in life, they'll have only one. But in Africa, children are seen like wealth. It's just like wealth. Okay? And it's our culture. Because we're not going to throw them away. Okay?
So so there's this stuff I've actually been thinking about. I think you know about superfetation twins. Superfetation.
Okay, superfetation.
So I want you to really emphasize, because it is, I cannot think about it. Having a child, you are pregnant, you are seeing your period, you ovulate, and you are pregnant again.
Okay, normally when I teach medical students, I say there are some things we are not meant to be discussing, but you may see them across in the literature and discuss them. Like you said, superfetation means a woman that is already pregnant conceiving again while she's pregnant. Is it possible? Nothing is impossible. But is it common? It's very, very rare. Why? If someone, there are a lot of reported cases, okay, out there. Have I witnessed any? Nope. It can only happen, the only way I can think it will happen in this modern practice now is with the advent of IVF. Maybe someone suddenly is pregnant, okay? Then without knowing, it happens in the clinic. Someone comes to the clinic while you're assessing the person, and maybe you're not thorough in your assessment. You will know that she's pregnant. Then you go ahead, and especially those that use donor egg, you will go ahead and do your IVF, then bring the baby in when one is already inside, okay? But the real superfetation is when someone is pregnant. Because pregnancy on its own is supposed to inhibit ovulation.
Yes.
Okay? Supposed to inhibit. Because the pregnancy hormones, the estrogen and progesterone will be very high when someone is already pregnant. And when they are very high, they stop the follicle stimulating hormone and luteinizing hormone from being secreted. And if they are being stopped, the ovary will not be acted upon. All right? But whoever that reported that such a thing exists, and that's why we have them in medical literature today. So when the people ask you, what are they? Just tell them getting pregnant when you're already pregnant. But it's something that is very, very rare.
A case, a
Where?
personal case. My auntie, it happened to her. She was pregnant. Then after 3 months, she got pregnant again.
Okay. So maybe, I hope her case was reported as a case report. Because there are a lot of things I have to say something, but we have to be careful with what we discuss. Like, someone will come to the clinic and tell you something that you know that's not true. I used cryptic pregnancy, for instance. It's a common thing out there now. If you check it on the internet, maybe after this podcast, you check it.
Yeah, I know.
The cryptic pregnancy is that a woman gets pregnant according to what they tell them, and it can't be seen by ultrasound. If you do pregnancy tests, it will not be dictated. Then you have specific doctors that will be able to deliver such pregnancies. You dare not see another doctor that is not well known in management of cryptic pregnancy. But it's just fallacy. What is that? Cryptic pregnancy is just a woman that wants to conceive, like as you are now. If I want you to be very big, just 2 or 3 hormones I will give to you, start to put on weight on different parts of your body. Okay? Give you anabolic hormones, you start to put on weight. If I want you to stop seeing your menses, I just give you some drugs. The menses will cease. Okay? So these people were able to, some of them have these drugs in their closet. So when a person comes, you have unwanted pregnancies out there. And these young ladies that conceive, they don't want to keep in fact, they want to terminate. Now, if you offer them money, say, why not carry this baby? If you put to bed, I will give you 1 million.
1 million is small now.
It's a big money in this current Nigeria. It's big money. So now, what they do, they keep them. They house them in different places. After all, the girl had not seen 100,000 in her life before. Okay? So house them. 9 months is not long a time. Keep them in those houses. Then keep injecting this woman drugs. Sometimes because it's drug, the woman may bleed. If she bleeds, don't worry. After in pregnancy, people do bleed. Now, they wait for the girl to deliver. Immediately get put to bed. Of course, they must have scanned to know whether it's a male child or a female child, and the prices differ, okay? So immediately the girl delivers. There might be 2 or 3 of them that deliver at different days. They'll call you, say, come over. It is time for you to deliver. If you see a woman that I have about 3 of them in Oka here. Now, but what I do is, in life, you also should be careful how you manage people. You should try as much as possible to help people to be happy. If you're doing something that is not dangerous to your health, you can allow the person to live a healthy life, a happy life, and move on with his life. Because what will you gain if you keep telling the person that it is not your child and it's not that? Then what will you gain? Okay? So when they come to the clinic, they say, I had 2 boys in a cryptic home. Okay? As when you were delivering the baby, was your husband there? No. Okay, tell the woman or whoever that is in charge of that place that your doctor said that he will pay such amount of money to be inside the labor room when you will deliver. They said, no, not everybody will be there. Okay? So there are things like that. Why I brought this cryptic pregnancy with regards to your auntie that had superfetation 3 months afterwards. Yes. Okay? There's a lot of things that happen that you may not know exactly what it is.
For her own was natural.
And yes, that's what I'm saying. Someone cryptic is natural. They don't know. It's natural now. So you just come and give you injection, you get belly. All right. So, but there's a terminology like that, superfetation. There's something like that. It's very rarely may not. It's not something that I've seen.
Okay. So can we talk about like male fertility? Let's I want us to like emphasize on male fertility. Because everybody thinks about, oh, because she had abortion, you were taking postinol, you were doing this, you were doing that. They don't look at men. They say weed is healthy.
Okay, yeah. Male infertility is also the common thing nowadays. I've said it's about 40% responsible for inability of couple to conceive. The only challenge we have is that the society we find ourselves in, the females are seen as if they are the cause. Secondly, the male, they shy away from the problem. And because of that singular act, research has been gone so wide in female infertility. Why in the male infertility we have little thing? For instance, in the clinic, if couples come to the clinic, I'll be able to assess them. And if the problem is from the woman, sometimes you may be able to sort it out. Few occasions you end up in IVF. If it's a man, you start to have problem. Because the way they shy away is only when you present yourself that people can be able to know what is wrong with you, okay? And as I said, when they come to the clinic, in fact, the man would hardly come to the clinic because he believes that he shouldn't discuss his fertility issue with anybody. That the man should not tell him when to have sex with the wife, okay? That is his duty to decide when to have intercourse with the wife. And there shouldn't be another man out there. Now, when he's dragged to the clinic, he gets to the clinic, he wants to see the doctor immediately. Immediately he comes and tell them that the doctor, I want to see you now. Now, if he cannot see the doctor at the moment, he goes to his car, if he has a car, or goes to one shop, drinking, or maybe smoking. Now tells the wife, whenever it's our turn, I'll come in. He gets into the clinic. That's what I see on daily basis. First thing he will do, he bring out his phone, start to press it on it. Why the woman be asking important questions? Now, when during the discussion, you may decide to talk to two of them. During that discussion, when they get on, the woman calls you. Say the wife, the husband is now asking, what then again did you say in the clinic? Okay? So it's a problem. All right?
So I'm trying to say,
and unfortunately, I would like to say, to assess a man is the simplest thing you can do. To assess women, you have a lot of invasive things you will do. Sometimes you need to open the woman's, let me use people's stomach, to open the woman's abdomen in order to assess the reproductive organ. But for a man, just produce sperm. You do seminal fluid analysis. From there, you know whether he's fertile or not fertile. Okay? But they cannot come to give you that sperm. Then when they give you that sperm and it's not good,
they will not come again.
No, it's war. No, he will believe that it's gone, it's finished. All right. So people find it difficult to discuss. A woman will get to, like, as we are here, a woman comes here and start to discuss with everybody that I'm looking for a child. A man will not do that.
Yeah.
He won't. And if the whole wife starts to discuss that, he will step out. It's a problem. So, but we'll try with education. What is happening now, as you mentioned, internet. You know, with internet, you may post something. Someone, because men don't want their problem to be discussed in the public. So if he opens his phone and find out that this thing is exactly what he's passing through, he may secretly call you and assess care.
Yeah.
So with this advent of things that's happening in internet, that's good aspect of internet and education, it may get better. After all, in the past, what the man would do doesn't go to the clinic. What he will do, he will go and pick another wife. If he picks two and they are not pregnant, he will pick the one that is already pregnant.
Yes.
And society accepts that.
So you can say men are one of the issues.
No, they're not. No, not. It's a couple thing. It's a couple thing.
Well,
and if you see from that angle, it will help us. Because women have a lot of things too. As I said, a man only needs to produce sperm. The women, they don't need to produce only egg. They need their womb too. Okay? So if a woman is ovulating, it doesn't end there. She also needs to have good uterus.
But is it possible for a woman to be ovulating and not be fertile?
Why not? If you understand the physiology of conception, I said earlier, ovulation, intercourse, good sperm, fertilization, implantation. Problem in any of these 5 places will cause infertility. She's ovulating, but her womb is not good for baby to implant. Baby comes in, it cannot, okay, as we are inside this place, okay, we're able to sit because we have this seat. Let us assume that I enter there, there's no seat. Can I sit? No. So if a baby comes in, there's no place to implant, the baby just dies. All right? So a woman can be ovulating, but the womb is not good enough for implantation to take place.
So let's go back to IVF now. There are cases where in IVF, they get like 4 embryos and implant it and none stays. In most cases, what's the cause for embryo not to, settle in the womb? Because many women do IVF like daily basis,
yeah,
repeatedly.
Okay, look, a lot of things that can cause implantation failure in IVF. Our level of education in this part of the world is a little bit lower. So I will try to use what happens in our daily activity to explain that. Have you seen people that do medicine when they plaster wall?
Okay. Yeah.
They get the mixed cement. Mixed well, the wall is good. They take the cement, just put it on the wall. It was supposed to gum.
Yeah.
All right? Sometimes they put it on the wall. What happens? It falls off. They mix it again and put it to gum. Now, if baby is coming inside the womb, let's assume that you've done the IVF perfectly well. The embryos are good, what we call blast. You prepare the endometrium, the uterus, you look at the lining of the womb, it's good. It's okay, let me transfer 3 for this woman, believing that they will implant. Now, if you've seen where we do IVF, you don't get the embryo one by one. I say, okay, this one you stay here, this one stay here, this one no. So you put in a small syringe because you don't want to irritate the lining of the womb. So what you do, you get into the lining of, just press it like this and come out. That embryo may just come and hit here. And here happens to be the worst place in the womb. Remember when we say that you're okay, doesn't mean that you're 100% perfect.
Yeah.
Okay. So if it hits here, it may fall off. Now, if it falls off, if that embryo is not denatured, it's still okay. It may fall to this place and implant. Or it falls off and die. That is it. And that's why you may put 3 embryos and the person gets pregnant. You do scan, you have only 1. Okay? It's still a good one.
So it means that during the implantation is just a guesswork?
No, it can't be a guesswork. If you can understand what I just said. Implantation is under ultrasound guidance. If you have the embryo, okay, it's inside a small syringe, insulin syringe. Then in a small catheter, we'll call it embryo transfer catheter. Someone will put a scan on top of the woman's abdomen. So as you're passing the catheter, you'll be seeing the needle, the catheter. You get the catheter into the womb under vision. So it's not that you're doing it without seeing. It's under vision.
She'll be
No,
aware.
No, it does not. If I touch your body, will you feel anything? Just discomfort. Okay? The catheter is just discomfort. It's not going to cause pain. So under vision. But what I'm saying that under that vision, what you do is to release it. Just like if I take syringe to pick water from that bottle and want to put it inside this my little cup I have here, just splash it inside and come out. That's what you do. Now, the embryo decides where to implant inside the cavity of the uterus. So it's not a guesswork. It's a well-calculated work that you do and make sure that you transfer under the ultrasound guidance. But I'm saying that baby that gets to the uterus may not implant. I use plastering. When you take your cement and put on the wall, is it guesswork? No. You've seen where you want to put it, but they decided not to gum there. Okay? All right. That is one aspect. Another aspect is, unfortunately, the woman before that implantation, before your IVF, the womb is not good. But you've done what you could do to get it better. Third one is that embryo you're transferring is not a good embryo. So a lot of things that can affect IVF.
Wow. So looking ahead, what do you hope that would change about how we talk about fertility in the next 10 years?
Education.
Wow. Why education?
Yeah. If you educate people, they get knowledge. When they get knowledge, they know that they need to assess themselves early. For instance, if a woman is 22 years, as you earlier asked me, she should know if she's educated and she know her reproductive system. Because one of the challenges we also have is People hardly discuss their reproductive organ.
Yes.
You shy away from that. Something that you have in your body. You don't want to discuss it. Now it's now where you fall a victim that you want to discuss. But then, okay. So once someone is, if you see someone that is educated, you should also know that one, at this your age, you should try as much as possible to conceive if you can. Now, if you're not ready to conceive and you still want to use your egg, that's your precious egg, you may go somewhere and keep them for future use.
Freezing.
Yes. You may go somewhere and freeze them for future use. Not when you're 40 years, you come to the clinic of 45, 50, say, Doc, I want to use my egg. I'm still seeing my messes. Okay? Someone that is not educated doesn't have this information.
Yeah.
Cannot do anything. Yeah. Then someone that is educated knows that sexually transmitted diseases will cause infertility in a woman and in a man. Okay? A man has orchitis, that is inflammation of the testes, will affect the testes. If a man is educated, he knows that nylon undies are not good. Heat is not good for where the testis is. Okay? So, with the level of education we have, it wasn't like this during our own time. During our time, people don't have phones. They don't. Okay. Today, a young chap can check the internet. Okay. So things may likely get better, and the technology we have in fertility clinic will also get better. What we used to do in IVF 10 years ago is not what we do today. Yeah. Today we do ICS, ISCI, intracytoplasmic sperm injection. Before now, if a man has sperm count of 1 million, they can't do anything. Today, if you have even two sperm cells, you can use it to do IVF. Okay? Wow. So with time, in fact, there is new technology that is up now, where if you want to do a gender selection or do pre-genetic testing, you need to biopsy, that take one cell from the embryo before you go and test it. But today, nobody does that. And as in, the new technology now means you can take fluid from the dish, and with that, you analyze the embryo. Just like you can take blood sample from a mother, and you know the type of baby you're carrying. Okay? Yes, there's technology like that.
Wow.
Okay? Like if you're pregnant, you want to know whether it's a male child or a female child. You want to know whether it's a sickle cell patient or not.
What I need is
yes, just take mother's blood, do analysis with it. In fact, the lab is even in Nigeria, not as far away. There's a same lab at Lagos.
Wow.
So with time, the next 10 years, a lot will be in place. But it's only education that will make people to have access to those things.
So are you saying that even a man with low sperm count can still have a child?
Why not? If you have one sperm cell, it's not only one sperm cell that is needed to fertilize a woman.
But most people say, oh, if he has low sperm count.
Yes, now look at it. See what happens. In a woman's body, God created a woman in such a way that her body is wide open. Okay? A woman's vagina is connected to her inside body. It's not like that in a man. So if a woman gets exposed to bacteria, the next is, if there is no barrier along the line, what happens that microorganism gets into the woman's body and cause sepsis? The woman's vagina has that barrier. You have a bacteria called lactobacilli that produces acid in the vagina of a lady. So what it does is to destroy anything that gets there, including sperm. Okay? So for a woman to get infected, that's why some women may have intercourse with someone that has sexual transmission. They may not contact it. It's not that the person did not deposit, only because her body was able to prevent that from. Now, if you have large quantity of microorganisms in the vagina, it will now overwhelm that protective mechanism in the vagina. It will now move into the uterus, from there get to the body and cause infection. So the same principle, you need large quantity of sperm to be able to permit. So that's why we tell men that they have 20 million, 15 million or thereabout. But in IVF, there is no such environment. Okay? So if a man you look under the microscope, you see one or two, so take it and fertilize.
Wow.
See, technology can do a lot.
Wow. So, okay. If every woman or every young woman and a couple in the world can hear just one message from you today, what would it be?
Assess yourself on time. Take good care of yourself. Be you a lady or a guy. Live a healthy lifestyle. If you don't do that, if you're careless with yourself, later in life, you may regret it. Let me give a typical example. Termination of pregnancy. It's not from religious background or trying to say whoever that does that will not make heaven. No. Unfortunately, in this part of the world, abortion is restrictive. Restrictive in the sense that the law does not permit a woman, a doctor, or anybody to participate in termination of pregnancy. So that means whoever that is going to do it for a young lady may likely be someone that is not well qualified, or someone that is qualified but his practice is not good enough. So he's not likely going to do it perfectly well. Remember, a woman has only one womb. So if you take your one, it's not like one-eyed man to someone that doesn't know his work well to handle, he may damage that womb just for one single act. So for a young lady that is educated should know, if you're sexually active, you have to be careful. One, you protect yourself from sexually transmitted disease. Try not to have an unwanted pregnancy. If you have, don't try to terminate it. So that's why if one is educated, these things you'll be able to shy away from them. Okay? Likewise for a young man, that if you live unhealthy lifestyle, start to take plenty marijuana, cigarettes, and so on and so forth, that it may affect your reproductive organ. So that's the information, that's the message I give to them. Say, this is the life you live, because when you may need them, it may not be there.
Yeah.
Surprisingly, we have things like people do donate sperm and egg. Currently, we find out that the young chaps we have, majority of them have low sperm counts. And it might be because of the lifestyle they live. A young chap comes to the clinic to assess his sperm, you find out that there's nothing in it.
Wow.
Then when you probe more, you find out that his lifestyle is something that cannot be written or cannot write home about. What do? You advise. So
thank you so much, Dr. Kwala. It's a pleasure to have you here today. I mean, it's a wonderful section.
All right. I once more thank you again for having me. As earlier said, at least I'm amazed to see something like this here, and being the very first person to. If I was supposed to give me an award to be your first guest, right? To grace this seat, and I also encourage you. It's a good one. I think people should be discussing health. We should stop discussing social things. We should be discussing health. I encourage. That's a good one. Huh? Keep it up.
Thank you very much, sir.